Honorable Dr. William Ruto, the President of the Republic of Kenya. Let's be upstanding and we welcome the President. Let's appreciate the President as he walks in.
I can tell this auditorium that by the time I complete my term, my first term, I can tell you I will have discharged all the commitments I had made and made sure that every mother who walks out of hospital will walk out with the diapers once they give birth. Let me also say, another gentleman, and I wish he was in this room today, who told me that time that I was a candidate then, Mr. Deputy President, please find a mechanism where citizens can contribute, not a fixed number as we were doing, but a percentage of their income, a percentage of their salary. Today, in this auditorium, all of us know here that each one of us contributes 2.75% of their salary or income. The people who are paying the most at 5% have come down to 2.75%. Those of us, like me, who was paying 0.01% of my salary, today I pay 2.75%. We have made contributions equal as a function of your income. That was what I was asked by that gentleman. That is what we have done. So, in short, on that list of the commitments that I made to the people of Kenya, I will be ready for the exam next year. I will be ready for the exam next year. And my target is to get 100%. The management cost under NHIF was 40% of the collections at one point. In 2022, it was 17% of collections went to management. Under SHA, we have brought down management cost from 17% in NHIF to 5% in SHA, number one. And the cost of technology that we are using is included inside the 5%. That is where we begin. And we have said, for facilities, and I saw one of the headlines there saying that there is a ghost company being paid 1.2 billion by hospitals. You know, for your information, hospitals do not pay any private entity. Hospitals pay DHA. And the cost is this, so this skunk thing is a fallacy. You know, ile mimi naita saa zingine ufala, ndio hiyo. Na hiyo 1.2, mnaona pale, there is a 1.2 billion, sijui some farm. I can confirm to you that that is money paid to DHA. And the money paid to DHA is in law. Facilities pay 2%, but with a maximum of 5,000 shillings per claim. And it is in law. It is not something you go and negotiate in the bush. It is in law. And we have made sure, and I can answer any question from anybody on the amounts of money we are paying for technology. And every payment is underwritten by law in regulations to make sure that we protect public assets. There are many people who say I was elected in 2022 merely because I said hustler and bottom up. Today, I think you have seen that I made commitments. I had a plan. And I made commitments to the people of Kenya. And it is on that basis that the people of Kenya gave me a mandate. And it is what is expected of every leader that if you want the mandate to lead a country, you must give the people your plan, your vision, your commitment on what you're going to do. And this evening, I am going to answer, and I'm very happy I saw the commitments I made before the election in 2022. Number one, I think I made like 7 or 8 commitments on matters health alone. 7 or 8 commitments. Commitment number 1, I said that we are going to have a health system that is going to make sure that every citizen can have access to healthcare. I called it that time hustler. But we came and said it should be called Social Health Authority. Today, my commitment on making sure that we have a system that works, a system where Kenyans can access health in a predictable manner, today is a reality, and 32.3 million Kenyans are registered on that platform. You remember the gentleman who asked there and said about emergency, and that he told me that time in 2022, I think it was June, he told me government must operationalize the emergency facility because too many people will lose their lives, because in an emergency, if you go to a hospital, the first thing a hospital will ask you, who is going to pay the bill? And in the process of asking all those questions and finding out who will pay the bill, we lose lives, we lose people. That is why we went to Parliament, we passed the law, we now have an emergency, chronic, and critical illness fund that now funds emergencies. And 2-3 weeks ago, we launched that facility, which comes complete with an ambulance facility paid for, emergency service for the first 24 hours paid for, and beneficiaries don't have to be members of any insurance facility, including SHA. You don't have to be a member of SHA. So long as you are in an emergency, the government of Kenya, as was requested, as I was told in 2022, and I committed to do it, today I have discharged that responsibility. 2 weeks ago, we launched the facility, and we are moving. We have already changed the way our Linda Jamii program operates. You remember, the Linda Mama program operated differently from the Linda Jamii. The Linda Mama focused on the mother and on delivery. Today, the Linda Jamii program focuses on the mother, focuses on the child, and focuses on the household. The numbers have changed. Linda Mama was 2,500 paid or refunded for public facilities, 3,500 for private facilities, 6,500 for cesarean section, 10,000 for private hospitals. We have changed that metrics. Today, from 2,500, we now pay 10,000 for all facilities, irrespective of whether they are private, public, or faith-based, for normal delivery. We have increased 4 times what was being paid. Number 2, for cesarean section, which was 5,500 in public facilities, 10,000 in private facilities, we have raised that up to 30,000 for all facilities. So we have equalized all the facilities, because a mother giving birth in a private facility is as good as a mother giving birth in a public facility or a faith-based facility. We have equalized that whole space. We have designed a digital system, and I want to say this with clarity. This whole ecosystem would not have been possible if we didn't have a digital system to make sure that everything, as I said earlier in the day, that every patient must be visible. Every treatment must be traceable. And every payment must be accountable. That is what the digital system enables us to do. And Akili, what did we do? We did not buy the system. Just the same way, today we have MRI machines, we have CT scan machines, we have theater machines worth billions of shillings, but we haven't paid a single one of them. What we have done, what we have told manufacturers is they invest in the machines. They bring the machines, we pay for service. For every one service, we pay. It is their business to maintain, to make sure the machines are working. It is their business to make sure that the machines are operational. They service the machines, they provide the consumables. Ours is not to buy machines. Ours is to provide service for citizens who want treatment. It is the same thing we did. We asked companies to invest their money in a digital platform, a health digital platform. They invest the money, we pay for the service. Habari yako, ma'am?
Salama.
Very good. Unaitwa nani?
Mimi naitwa Naomi Mutendwa.
Naomi. Wewe ndio mama wa Lydia? Very good. So, uliregister kwa SHA? Ukalipa pesa ngapi?
10,200.
10,200. Alafu mtoto ulimpeleka hospitali?
Nilimpeleka hospitali.
Akatibiwa?
Hapa Kenyatta akatibiwa, lakini nilipeleka Garissa nikaambiwa nimlete Kenyatta na akatibiwa na katoka vizuri.
Okay. Bili ya hospitali ilikuja pesa ngapi?
Ilitoka na 1,168.
1,168. Ulilipa shilingi ngapi kwa hiyo 1,168?
Hakuna kitu nililipa.
Huyo msichana wako akatoka hospitali akajiendea nyumbani. Na nimeambiwa ya kwamba anafanya form 4. Lydia, my very best wishes on your exams. Ukienda. Na asante sana mama kwa kuja, kwa sababu niliongea mambo yako, nilielezwa na watu wa SHA mapema leo. Asante sana kwa kuja. I really appreciate the support and the leadership of the county governments in the delivery of this service. But the heroes of this delivery are the people of Kenya themselves. Without the contribution of the people of Kenya, the 2.75%, it would not have been possible to provide this service. And you know, there is nothing as critical as a sovereign state. If we were delivering this service on either borrowed money or on money given as grants by different benefactors, we wouldn't be here. This is a service, this is a program that has been delivered by the people of Kenya with their own resources, with their own professionals, with our leadership. All we provided was leadership. The rest came from the people of Kenya. And I am very, very proud that today we speak in this auditorium of what we have achieved. The numbers speak for themselves. And I can confidently, without fear of any contradiction, say that today health is not a privilege for those who have jobs or who have income or who have means or who can afford, but health is what the Constitution envisaged. In Section 43, it is a right for every Kenyan. And I am very, very proud that we are there today. So again, back to you, Mercy. We started with the commitments I made. I am happy that the record will speak out for itself when the time comes. On the commitments I made, and also it has contextualized. You know, there are some of the people who think that I was elected on the basis of noise. It was not on the basis of noise. It was on the basis of a commitment I made to the people of Kenya. And the commitments are there. You saw it for yourselves on what I was going to do on universal health coverage, on what I was going to do on CHPs. So anybody seeking elective office, please avoid the noise, avoid the slogans, have a plan. Because the people of Kenya are intelligent. They will judge each and every leader on the basis of their plan, on the basis of their commitment, not on the basis of slogans and noise. If you continue on the basis of slogans and noise, you will be in for a very rude shock. You all appreciate that it is not any mean achievement to get the kind of endorsement you receive from a trade unionist. You really have to work hard for it. Daktari, I agree with you on all your assessments. There are areas we have succeeded, but there are areas that require improvement. You have said, first, where did you find my manifesto? Oh, it's a public document. It's a contract. Thank you very much. And you have done correctly. You have said out of the 13 issues that I promised, there are 2 that are outstanding. If you were a teacher, if somebody gets 11 out of 13, roughly 85. That to me looks like an A, right? But anyway, I said I'm aiming for 100%, so it's work in progress. So let me say of the 2 things you have mentioned. Number 1, you have said, what is the progress on the commitment that we made in the manifesto on progressively making sure that there are 20,000 health workers hired to assist in the transition to universal health coverage. I can tell you, Daktari, that number one, we've already committed to transition all the doctors and health workers that were hired under the UHC program from being from contract to permanent and pensionable. From this month, all those people are now transitioned, and the 7,800 of them, I am having a conversation with our counties. In the event that the counties have a problem absorbing them, I can confirm to you that we will absorb them as national government and place them in whatever facilities we consider fit. But I am sure that we are going to have an agreement with our friends in the counties. Number one. Number two, we have already committed this year to hire 5,000 health workers this year. We have already hired another 4,000 from in our referral hospitals. Our referral hospitals have hired 4,000 health workers in the last 4 years. So if you add 4,000 hired by our referral hospitals, 5,000 we are hiring this year, that is 9,000, 7,800 we are going to make permanent and pensionable. Roughly that is 16,000 out of 20,000. But that's not the full story. Our counties, and I must commend our counties, in the last 4 years, counties have hired 28,174 health workers. So if you look at my manifesto and you count all the numbers, we have actually exceeded the 20,000 that we put in the manifesto. That is, even if you want to look at it as health workers hired by national government alone, we are already at 16,000. So we're not too far away from hitting our target. But if we look at government in its totality, we have already actually doubled the 20,000. We are at 40,000 and something. So we're in good space, Daktari. Number two, you have mentioned about collective bargaining agreement. And you want us to do this time round without a strike. So, and I want to undertake that we will establish the necessary committees for us to engage. And please, let's do it without a strike. We are ready to engage, and I'm sure we will agree. All of us are reasonable people. We will make sure that we put the interest of the people we serve, the Kenyan people, ahead of our own interests, either political or in your good offices of the trade union. So I'm sure we will agree on that. And then the last issue that you mentioned was?
SHA reimbursements.
No, he said
premium payments.
Two things. You said there are some health workers, doctors, that have not been paid by counties, their last month's salary. And I did undertake that we will have a better working engagement with the counties to make sure that they deliver on their commitments and on their mandate. I have two things to tell you. The governor sitting in this auditorium will tell you that for the year 2025-2026, we did not cross over with any monies due to counties. We paid all the money. Number one. Number two, the money for July, the money, the shareable revenue for July due to counties has already been paid. So we have no money outstanding on our part due to counties. I am sure our good counties are making arrangements on how they will pay those who have not paid. You've said there are some counties that have not paid salaries for these hardworking people. I am sure they are making arrangements, and if the chair of the council has something to say, he will have the opportunity to say it. But from the national government point of view, we have disbursed all monies due to our counties. For last year, up to June 30th, and for July this year, they received it in the month of July. And I'm sure they are making arrangements. I agree with you that it is not possible for us to be able to effectively deliver on universal health coverage if SHA reimbursements are not done by everybody, you know? And I agree with you 100%. So for the facilities, for the MDAs, ministries, departments, we have made sure on our part that we do it as we do salaries and make sure that facilities have, SHA have their money. I will ask all others, our counties, parastatals, and other agencies to do likewise so that we can enable SHA to be able to do the great job that they are doing. In NHIF, you paid and waited for 3 months for the cover to be active. In fact, many people are pushing me to say, why don't you go back to that? No. You cannot tell a sick person, pay, wait for 3 months so that you can come for treatment. What about if they die? Or if something happens to them? So the moment they come to hospital, if they are not registered, we register them, they pay immediately, and they access service at that point in time. That is how we have changed the metrics. And that is how we are going to do it going into the future. I remember saying also earlier about cancer. You know, we had a big problem with cancer, as we all know, and treatment. We have again upped resources for cancer from 500,000 to now 800,000 cover for all citizens registered under SHA. Every citizen of Kenya, so long as you are registered in SHA, you will walk into any facility, public, private, faith-based facility, anywhere in Kenya. So long as you're registered in SHA, you will walk in and walk out without paying a single cent for outpatient facility. If you have to be admitted for surgery or for other facilities, that is when you have to make a contribution. Or the government of Kenya, if you are not able, the government of Kenya will pay for you. But you will be assessed, and everybody will be assessed for what they can pay. Every citizen of Kenya, so long as you are registered in SHA, you will walk into any facility, public, private, faith-based facility, anywhere in Kenya. So long as you're registered in SHA, you will walk in and walk out without paying a single cent for outpatient facility. If you have to be admitted for surgery or for other facilities, that is when you have to make a contribution. Or the government of Kenya, if you are not able, the government of Kenya will pay for you. But you will be assessed, and everybody will be assessed for what they can pay. We said we are going to empower every facility to make decisions. We send the money not anymore to the county, but we send reimbursement for every citizen are dispensary treats. For every citizen a health center treats, we send the reimbursement to that dispensary. If they treat 20 people, we send reimbursement for 20 people. If they treat 1,000 people, we send reimbursement for 1,000 people. But financing is not the only challenge. The other challenge is equipment. To be able to provide service, you need the theater, but you also need equipment. And so we agreed and we designed a program called National Equipment Service Program. Yeah? And how did we do it? We said, let us pool all our facilities and negotiate together with manufacturers. Because it is difficult for manufacturers to go and negotiate with a dispensary or a health center alone. But if we pool together, through the economies of scale, we can be able to have the muscle to negotiate for better prices, better facilities, and also for the manufacturers. It is easier for the manufacturers to deal with us as one entity than to deal with us as individuals. They are assured of their money being paid, and they are assured that every facility is going to pay their bit. So, today we have equipment supplied by manufacturers, equipment that has not been paid by the facilities.
Good evening, Mr. President. My name is Lois. I'm a person with albinism, and I stand here to speak for persons with albinism and persons with vitiligo. For us, sunscreen lotion is an essential. It's not for cosmetic purposes. And mostly, it's not covered using the social insurance cover. So, whom do we go to? Or what approach do we take for us to make sure that we have it, since most of the times the government provides it, but it is not enough, and at times it's not there at the hospitals. So
we are paying 2.75% of our income. We should know that countries that provide universal health coverage pay up to 15%. Go to any country. It is not 2.75%, it is 15% for them to provide the full package. We have started with the package that we have. But I think, to be fair to people living with disability and others who have conditions like the one Lois has said, including vitiligo and all the others, I think it is time that we come back to Lois and tell her at what point will we include the sunscreen she is looking for. And I want to tell you this, Lois. It is homework you have given to me. Let me take it home.
And Your Excellency,
I will have an answer for you and for all the others who are like yourself. It is not possible for us to deliver health. It doesn't matter how much money we have. It doesn't matter how much equipment we have. The people ultimately are the ones who deliver this service. And I think it is only right that we have a take from them where we are, where we were, and what they want us to do going forward. I don't know, Mercy, whether...
Yes, thank you. They sat strategically next to me and carried the plan. So since I don't want them to strike outside my office, let's give them the space to ask their questions.
Please,
you so much,
your name, my brother, and...
My name is Dr. Davji Bimji Atela, the National Secretary General for Doctors Union. Your Excellency, the book of the Bible, chapter 1, John chapter 1, verse 1 says that in the beginning there was Word, and the Word was with God, and the Word was God, and through the Word, everything was made. So it is out of dialogue and conversations that reality and great things are done. So I want to thank you for this inaugural Health Summit that has brought us together and that has been organized by the Ministry of Health with Mr. Fixer, the CS Health, and my predecessor, Dr. Omo Oluga, and the PS Modani. I also appreciate the governors for sitting here all night to have this conversation, because health is partly national and partly in the counties. I'm speaking here, Your Excellency, to first of all appreciate you that before we had CS Health on Aden Duale, who is a politician, coming to that particular office, we had a lot of demonstrations and a lot of strikes that were mostly being led by my predecessor, Dr. Omo Oluga. I think one of them was led for 100 days in 2017, before the 2017 election. And also, I know we've had a lot of engagement to make things work. To start, for every year, for intern doctors, intern nurses, intern clinical officers, and all the health worker interns to be posted. We had a record and a plan that in February and September we had to demonstrate. And we were very good at demonstrating, and we will demonstrate on the street to demand for the interns to be posted. After interns were posted, we had again to start demonstrating every 5 to 6 months for them to be paid. And it's a reality that is known by all the intern doctors from 2010, that we had some money called boom, that you go for internship knowing very well that you'll be paid after 6 months or when budget is passed. And the reality is what happened in the previous years. We used to have cases of interns who were working in the facilities and actually have to die by suicide because they could not survive the situations. But as I stand here today, based on Mr. Fixer Aden Duale and my brother Oluga and the PS Mudoni in your government, I'm saying in your government because you're the one who appointed them. For the last 3 years, 2024, 2025, and 2026, we have had interns being posted without demonstrations. We have had interns being paid their salaries in the first month of posting. Even those who were posted in the mid-July are getting their salaries this month. This is an improvement because we had accepted abnormality in the sector. So I want to thank you for that. Again, when I came to the office, where I've been in the union for 15 years, but I was elected SG 6 years ago, Dr. Oluga left a very big document called Collective Bargaining Agreement. This CBA was signed after a lot of strike, but once it was signed, deposited in the office, and then you took away our good friend, Dr. Thuranira, we were looking at how will this CBA be implemented. We tried to engage from 2017 to 2021, but there was no outcome. I think that's why Oluga probably left to go to the ministry to help the minister to implement it. We went on strike in 2024, and I remember we came to State House on 11th of May 2024. We had an agreement with the negotiating committee, which was headed by the Council of Governors, the Ministry of Labor, the Head of Public Service, and the Ministry of Health. And they offered and agreed with us that they'll pay our arrears of 7 years in 5 installments. That means they'll pay it in 5 years. But you said that utamu wa deni ni kulipa. That instead of paying doctors their arrears for 5 years, you'll pay it in 1 year in 2 installments. As I stand here today, the 5,693 doctors across the country received their 7 years arrears. And the arrears of 2024, 2025, we had a meeting with the minister who promised to pay by November this year. We believe in him because when he said before, the promises he had given us before have actually been implemented. So we have no reasons to doubt. The other part which was remaining for the county government, the 2025 arrears and 2026 arrears. We had a meeting with the Council of Governors, and the chair on Abdullah is here. They gave a commitment that the payslip of this month, doctors will have their adjustment in the payslips. And today, the payroll managers were confirming that they've gotten the matrix. It then means that the debts of 2017 are being paid 9 years later. And these are being implemented by commitments of your government with the Council of Governors. And this we don't take lightly, Your Excellency. As I say this, I've also gone through your manifesto. And I've seen many things that have been said in this particular forum. I want to align with them. I know for sure that my grandmother, who is 95 years old, and my daughter, who is 3 years old, knows that this country has a social insurance. It is something that has been discussed in the political space. It's something that has been said, and we go and get care with it. I was in a hospital today, and I got an MRI, and it was approved. So it's a reality. The issues of infrastructure, we know and we appreciate the level of hospitals that have been built by counties across the country, and the involvement of national government to create level 6 and the investment they are putting in place. We acknowledge and appreciate this. The issues of NEP and equipment that have been said. These are realities, and doctors see them in the hospital. Your Excellency, as I say these things, in your manifesto, we have been looking at the issues that you promised us. And one that also is part of our return to work formula of 2024, which is now a court order. And I'll read it, page 23. Of these 13 issues that you committed to do, in the last 4 years, I've only noted 2 that have not been done. The 11 of them, with my brother here, Vizcaya, I say have been done. It's true they've been done. That, Your Excellency, as we enjoy the benefits of collective bargaining agreement, as we enjoy and trying to ensure that we don't have strikes, as we enjoy the working of SHA, the equipment, and all these, you promised us that you will prioritize employment of 20,000 healthcare workers. That is doctors, nurses, clinical officers, laboratory technologies, physiotherapists. And Your Excellency, we have only 1 year to get a new manifesto. And I want to ask you, what is the progress of employment of healthcare workers, including doctors? That's one question. Number 2, Your Excellency, the doctors, the nurses, the healthcare workers of this country are devoted to work, and they work so hard. They're the most honest citizens of this country. We believe and we benefit only from our meager salaries and wages that we receive every month, and we appreciate. And that's why I am so happy that you have Honorable Duale in that office. We have Oluga there and Mudoni, and we have Abdullah, who has given commitments that he will not see any doctor strike anytime soon. That as you are giving us plan on employment of doctors, we also want to know, and to be sure on the side, that this year we will have our CBS negotiated peacefully without having to go on strikes. Number 3, you said that you will have a mechanism to align engagement of healthcare workers and COG without undermining devolution. As we speak today, we have 33 counties that have not paid salaries. And these, our faithful, honest healthcare workers, ought to be able to pay their wages. We have the ones at the ministry that have been paid their salaries from other ministries, but the ones from counties, 33 of them have not. So we want to ask you, what strategies do you have in place to ensure that salaries are paid on time, even in the counties? Lastly, remittances. Your Excellency, as SHA works and as comprehensive medical cover for civil servants works, on the 9th of every month, when remittances are not done, our healthcare workers, our workers in the county can't access care. And yet later, the counties will remit the money. But then in that moment, they're not able to access care, we are having a problem. What mechanisms can you put in place to ensure that these are resolved? Thank you.
there are two schools of thought, that we are getting reimbursed, we are not getting reimbursed, we've not received any money from SHA.
So can we tell us which facility?
This was from Karen Hospital.
Yes. Do we have them online? Do we have them online? Do we have the CEO of Karen online or somebody? Why don't you call him?
Oh, do you want me to call him? Okay.
Yes.
All right.
Put him on the line.
Yeah, I mean, what he said, are you aware that many hospitals have not been reimbursed?
Not many hospitals.
Okay.
And
can you tell us how much SHA owes hospital services already provided? He felt that accountability for how much SHA owes.
No,
Yeah.
let's not talk generalities.
Okay, let me just call him.
Call him, put him on the line, let him tell us what is the experience in Karen Hospital. And I want my team here, The thing we do not want is people making general statements. Many hospitals have not been reimbursed. Which ones?
Your Excellency, I can confirm here that there's been quite a transformation since we started receiving the SHA reimbursement. We have been able to expand our hospitals with equipment from 2 theaters. Now, our referral hospital, we are operating 5 theaters, which means patients don't have to wait for a very long time. Another hospital, we started with 1 theater, now we have 2 theaters. And the third hospital, we now have 4 theaters. And all this equipment we're buying based on the reimbursement we're getting from SHA. So there's a lot of transformation. And as far as the procurement of drugs is concerned, through KEMSA, Your Excellency, we've seen tremendous improvement. From the 40% which we started with, to now we're getting 83% of our orders. And even with that 83%, we still get back orders to fill the difference, which we still distribute to our health facilities. And for the SHA reimbursement at our primary care facilities, that has really improved our drug availability because they are able to spend at source to procure the higher support staff with the money, and therefore we've really improved services using SHA. Thank you.
Tunaongea mambo ya health kwa sasa.
Sure, Excellency.
Tueleze mambo ya afya, na wewe ni Deputy Governor, pia naambiwa ya kwamba wewe ndio CC wa afya kule Lamu. Ni kweli?
Ndio, Excellency, ni kweli.
Able tueleze your experience as a CC in Lamu County on number 1, NEST program, the delivery of equipment. How many pieces of equipment, how many facilities have you equipped using this program? What is your experience with SHA reimbursements? Have they improved your facility, and how have you been using the SHA reimbursements?
Asante sana, Your Excellency. Kwa ajili ya watu wangu wa Lamu, ningependa kuongea Kiswahili wapate kunielewa pia wao. Kwanza napenda kusema kwamba mimi nilianza kazi mwaka wa 2005 kama clinical officer, Your Excellency, na nimekuwa kwa hii space kwa muda mrefu, na nataka niseme bila kuogopa wala kuwa na shaka, kumekuwa na mabadiliko makubwa sana baada ya enactment ya zile sheria 4 ambazo zinahusiana na masuala ya afya. Hii hospitali ambayo tuko, Your Excellency, inaitwa maarufu King Fahd Hospital. Na hii hospitali mwaka 2020 mimi nilikuwa hapa kama daktari, na ilikuwa ikioperate na budget ya 5 million per quarter. Kufikia mwaka huu hapa tulipofika, hii hospitali inaoperate na budget ya 30 million per quarter. Na hiyo ni kwa sababu ya ule mpango wa SHA. pamoja na ule mpango wa digitization umepungua zile pilferage sana, accountability iko juu. Kwa ujumla, Lamu chini ya mpango wa NHIF, ukiangalia mwaka wa 2020, Lamu iliweza kulipwa milioni 35. Kufikia mwezi wa June mwaka huu wa 2026, ndani ya mwaka huu ulioisha wa kiserikali, Lamu iliweza kupokea 146.3 million shillings from SHA. Kwa hiyo tumeona tofauti kubwa sana kutoka pale mbeleni na sasa, na kupitia ile sheria ya FIF ama Facility Improvement Financing, hospitali zetu zimeimarika pakubwa sana, kwa sababu wako na pesa za kutumia hapa kwenye facility. Na napenda kutoa mfano mmoja, Your Excellency. Sisi hapa Lamu tunaleta daktari kutoka Kenyatta Hospital, tunamlipia tikiti ya ndege na makao ya hapa, wanakuja kutufanyia some of the procedures ambazo pengine tulikuwa hatuna uwezo kufanya hapa. Mpangilio kama huo ulikuwa hauwezekani pale mbele kabla ya FIF. Vile vile nataka niseme kitu kimoja, Excellency, masala ya National Equipment Service Program, kwa sababu hili ni jambo lilikuwa limenikera sana, limenistress sana katika mwaka 2023 na mwaka 2024. Sisi tulikuwa na CT scan lakini ilikuwa imekuwa mkebe. Sasa tulikuwa tunatuma takriban wagonjwa 30 kila mwezi kuenda Mombasa kufanya CT scan na kurudi Lamu. Sisi hapa kwetu huduma za ambulance ni bure, Your Excellency, lakini kama department tulikuwa tunainka ile expense ya mafuta. Hapa Lamu sisi tunanunua mafuta takriban kwa shilingi 215 kwa lita. Kwa mwezi tulikuwa tunatumia takriban 800,000 mpaka 1 million kwa mafuta peke yake, mgonjwa aende Mombasa na kurudi. Kwetu ilikuwa ni jambo zito sana, lakini twashukuru kwamba katika zile CT scan 4 zilikuja Kenya mwanzo chini ya mpango wa NESP, Lamu County iliweza kupewa CT scan moja. Na si CT scan peke yake, Your Excellency, CT scan ya zamani ilikuwa ni ya 60 slice, ya slice 60 katika ile uwezo wake wa kufanya ule uchunguzi ama ile diagnostic power yake. Hii tulioletewa ni 128 slice, iko na uwezo mara 2 wa ile CT scan iliyokuwepo, kumaanisha sasa tuna ile detection rate, hata wagonjwa ambao walikuwa na kansa hazionekani, kupitia CT scan hii tunaweza kuona. Your Excellency, ile mpango wa theater equipment, kwa bahati sisi kupitia mstahiki Governor Issa Timami alijitahidi tukafanya wenyewe ile theater na tukaweka equipment za urology, za laparoscopic surgery, endoscopy, colonoscopy kupitia mfuko wetu wa county. Lakini nataka niseme hivi, Excellency, sisi kuna procedure moja ambayo ni unique sana tunaifanya hapa. Ule Mombasa ni private hospitals inafanya. Nafikiri Coast General itakuwa imeweka sahihi ile kifaa, nayo ni ya kubomoa mawe kwenye figo. Ugonjwa huu uko sana hapa Lamu, ugonjwa wa mawe, kidney stones. Na pale zamani ilikuwa mgonjwa lazima aende Mombasa, pengine atumie 500,000 hadi 700,000 kufanyiwa procedure hii. Sisi hapa Lamu tukaanza kuifanya, na kupitia mpango wa SHA, SHA inalipa hospitali yetu 150,000 per procedure. Kwa hiyo mgonjwa ambaye ana SHA halipi hata shilingi kwa procedure hii, ambayo pale mbeleni ilikuwa lazima aende paka Mombasa kufanyiwa procedure hii. Mbali na procedure zingine za tezi dume, prostate, zile TURP, zile za laparoscopic ambazo pale mbeleni ulikuwa huwezi kufikiria kama Lamu inaweza kuwa na vitu hizi. Nataka nimalizie na hivi, Excellency, nisichukue muda mrefu. Sisi tulikuwa na shida hapa tukienda Mombasa kujaza mitungi ya oxygen. Nakumbuka Mheshimiwa Duale alivyokuwa waziri wa defense, wakati mmoja barabara ya Gamba ilikatika, na nataka nikushukuru sana Excellency ulivyokuja Lamu nikakushtakia, ukapiga simu pale pale hicho kipande cha Gamba kimalizwe, na kimemalizwa. lakini pale Juma barabara iliweza kusombwa na maji, ikabidi Mheshimiwa Duale atoe ile manuari ya Kenya Navy ituletee sisi mitungi ya oxygen na madawa. Lakini tunavyozungumza sahihi, Lamu iko na mitambo mitatu ya kutengeza oxygen, na kupitia hiyo tumeweza kuanzisha ICU ya kwanza ndani ya Lamu. Kutoka ile time Kenya ilipata uhuru, Lamu haijawahi kuwa na ICU. Sahihi Lamu iko na vitanda 6 za ICU. Kwa hiyo mimi nataka nishukuru sana Your Excellency ule ushirikiano ambao upo baina ya serikali yetu ya county na serikali yako ya kitaifa. Ni uhusiano ambao haumsaidii mwananchi peke yake, unasaidia kuimarisha sekta yetu ya afya. Hapo ndipo mimi mahali ambapo napenda sana mpango huu wa SHA. Kule kwa madispensary, kwa mara ya kwanza dispensary zetu zimeweza kulipa 20 million mwaka huu wa kiserikali ulioisha. Pale mbeleni sisi tulikuwa tuna operate na budget ya 800,000 kila dispensary, lakini sasa kuna dispensary zinapata hadi 4,000,000. Iko moja ya kule Kiunga, ule mpaka wa Kenya na Somalia, iliweza kupata 8,000,000, na kupitia mpango wa FIF waliweza kununua vifaa za kupima damu ambazo unazipata kwa level 4. Ile mashini ya hematology, mashini ya kupima vipimo vya figo na damu, mpaka wagonjwa wa kutoka Somalia, Your Excellency, wanavuka kuja pale Kiunga kupewa huduma zile. Na malizia kwa kuchukua fursa hii kukualika, Mungu akipenda, wewe na Mheshimiwa Duale na Deputy President muje mtusaidie tufungue theater, operation theater ya Kiunga tarehe 17 Septemba mwaka huu. Shukrani Your Excellency.
Asante sana. Asante sana Bwana Gavana. Tunakushukuru sana kwa maelezo uliotupatia kuhusu mambo ya Lamu.
Truly, the entire cocktail of interventions in healthcare has been transformative for Nairobi. Your Excellency, before you became president and before I became governor, Nairobi had no public ICU facility, which is shocking because people assumed that Nairobi had ICU facilities. Today, I'm proud to say we have the first NICUs going on. We have NICU in Mbagathi Hospital. We have pediatric ICU at Pumwani. And we have the capacity of 43 ICU beds currently from 0 in 2022. Your Excellency, we were receiving a total of 700 million shillings in 2022. From 700 million shillings, we have gone up by 271% to 2.6 billion shillings in Nairobi County. That's from 700 million to 2.6 billion shillings. In the last financial year, we got 2.6 billion only purely from our health facilities, and that is in the facilities, FIF. It is not used elsewhere. That is why today at Mama Lucy we're increasing a new 400-bed capacity facility. It is ongoing, the contractors are on site, and there's increase in all the other facilities. Today, Your Excellency, we have 0 maternal mortality. Pumwani used to be known for horror stories. I think everybody used to hear Pumwani on the news and Mama Lucy, and they cringe at what they hear next. Today we have 0 mortality at Pumwani, 0%. At Mutuini, you had my doctor there, the one who said Dr. Bingwa, at also 0%. And we're moving now these services closer to the people. Your Excellency, small facilities that would get 100,000 shillings a year even, like in Pipeline, Quarry Ward, are now getting 1.72 million a month, not a year. And they're using that locally to make improvements in healthcare, Your Excellency. Your Excellency, we have CT scans as well. We have put in 2 CT scans. We have theaters all over. Mama Margaret, for instance, has 8 theaters that we've been able to establish through the NESP program. We have 7,820 CHPs, the biggest CHP network in the country. And it is true, because Nairobi is a bit difficult. While the share is supposed to be 2,500, in Nairobi we do 3,500 for our CHPs, which is a bit more. So, Excellency, there's been full transformation. If you go to Madare 2, we are now doing a cesarean section and theaters right down at the ward. If you go to Kayole, Madare North and Kayole 2, and in all my 125 facilities, there's been that improvement. The story of Hakuna Dawa no longer exists in the county of Nairobi, and we hope to improve even more, because our target in this financial year, and I was telling SHA is around 3.2 billion shillings, and we know where it is going to come from. So SHA in our work, Nairobi.
It is not correct and not true that the Social Health Authority has done any upgrade on any government has invested in 104 billion technology upgrade. Your Excellency, what we did is build a digital superhighway, consumed of 43 systems, Your Excellency, to support universal health coverage. What are these systems, Your Excellency? The first is we realize our public hospitals, where many Kenyans go, do not have digital infrastructure to provide services online. Your Excellency, we brought to them 4 key things. Number 1, Your Excellency, we gave them gadgets, which are tablets or computers, that the private sector has invested for a period of 10 years with all upgrade, all maintenance, and all support. What has that done to us? Today, Your Excellency, the public hospitals, where many Kenyans used to go and get services, Your Excellency, used to receive only 35% of PHC under NHIF. As we speak today, 62% of that money is going where services are being provided. This is because we enhanced the digital infrastructure at the hospital level. We gave them, Your Excellency, software. This software has helped them with efficiency. This software, Your Excellency, helped them to track and be accountable for every patient, for every claim. During the days of NHIF, hospitals used to have files. They used to be approved in batches. They used to be transported, taken to county NHIF offices. They will still be transported, taken to the regional offices for approval. They will still be transported, taken to headquarters for approval. They used to be approved in batches. They used not to be checked. There was no accountability. As we see today, Your Excellency, every claim is tracked because we have enhanced that public sector, Your Excellency.
Your Excellency, Tenwek Hospital is a level 5 and has existed for the last 89 years. It's a mission hospital, and we now have a state-of-the-art cardiothoracic center. That's a level 6. The cardiothoracic center is actually the best facility in sub-Saharan Africa. And we are so proud of that achievement. And that has come through the collaboration with partners and also with the government and our church, which is the sponsor. So the experience that we have in Tenwek Hospital is that before 2024, before the rollout of SHA, every year we could claim close to 500 million. But last year we claimed 1.2 billion, which is more than double what we used to claim before. To June this year, we are about 600 million of the claims. We have received so far, for the last 18 months, we've received 2 billion out of claims that we've placed of 3 billion that we've placed with SHA. So that has really facilitated us big time. And like we said, Your Excellency, we are a mission hospital. And a number of the patients that come through our facilities, not only in Tenwek, but even for the faith-based hospitals, are patients who are really needy, and we cannot turn them away. We have to treat them. So what that did, Your Excellency, is when the reimbursement, because the reimbursement rates were really enhanced, it really helped us big time in the burden to treat these patients that were coming through the facility. And we are really happy and so grateful for that.
Every stage, whatever intergovernmental partnership agreement that we sign with the Ministry of Health, we have to protect our space with respect to devolution. And I want to confirm that all the agreements that we have had under all the IPAs were indeed processed through a full council, and governors agreed to it. Number 2, of course, like every other new system, there were teething problems, and at times as a council, will raise certain issues. But all counties and all facilities are better off today as a result of SHA. And the experience is the same across every single county. And this explains why on-source revenue has, in many cases, more than tripled in counties or even quadrupled. With respect to the issues that have been raised by Dr. Atela, Dr. Atela, you will agree with me, and you've said here, that as a council now, we are at peace with you.
I've opened the system, and this is real time, as at 21:26 today. Karen Hospital has submitted total value of claims 302,593,226 from the beginning of SHA. SHA has paid them 66.5%, so we've paid them 201,506,857 million Kenya shillings. We have rejected 9.5 million claims. That's just 3% of their claims. SHA has returned 40,284,778 to Karen to action. They have not yet actioned these claims.
For them to provide documentation?
Yes, to provide, exactly, extra documentation for ourselves. So what I am holding for Karen unreviewed is 51 million only.
Thank you very much.
Yes.
Now we have the CEO here of Karen. Mama Abari?
Mzuri sana, Your Excellency.
Yes, we are discussing matters health, and somebody told us that you have some views on matters claims.
Thank you very much, Your Excellency. This is Juliet Kikonyo speaking on behalf of the Karen Hospital, Your Excellency. I would like to say that we have been working hand in hand with SHA through our partnership with my office and that of Dr. Messi, and we would be happy to let you know that we have been able to do a number of cardiac procedures, especially through the cath lab, ranging from anything to do with angiographies and angioplasties. And most importantly, now we are able to do EPS studies, which is one of the few places in the region of East Africa and Central region who is doing electrophysiology studies. And these are all some of the cardiac packages that we're able to do with the partnership of SHA. In addition, we're doing open heart surgeries, both on pediatric and adults, through our program, which is also a partnership with SHA, Your Excellency.
So just for a good record, what is your experience as a hospital between what you had as an experience with NHIF and what you have as an experience with SHA? Is there a difference or is the same?
Your Excellency, I would like to let you know that through the office of Dr. Messi, we have had a better partnership because during this tenure of your presidency, we've been able to actually have collaborative meetings with the office around things to do with the operations, the claim management, and also payments, Your Excellency.
So somebody was alleging that Karen Hospital is complaining that they have not been paid by SHA.
Your Excellency, that is incorrect. To date, we have received almost over 100 million Kenya shillings from SHA, and we are very appreciative of that. And I'd like to say that that is incorrect information, Your Excellency.
Thank you very much, Dr. So we treat all the other stories as the usual, fake news and misinformation.
Kindly, Your Excellency, that is fake news, Your Excellency.
Thank you very much. Thank you very much, Dr. So, Esther, please check your sources before you misinform the public. Dr. Lesiambe, can you give us your experience as a manager of one of the largest facilities? How has your theater improved? How has service improved or not in Kenyatta? And then I want the CEO of Tenwek Hospital, one of the largest private health facilities in Kenya, to speak and tell us their experience. This is the largest public facility. We will also listen from the largest private facility. Yes, Richard.
Thank you very much, Your Excellency. Let me start by saying that Kenyatta National Hospital is the second largest hospital in Africa. I apologize by, correcting you, Your Excellency, because it is the second largest hospital in Africa. In terms of bed capacity, we are second to Chris Hani Hospital in South Africa. Now, Your Excellency, when it comes to management of health services in Kenyatta National Hospital and providing quality health care, we have to have equipment. And at Kenyatta National Hospital, as we speak today, we have 32 fully equipped theaters from 12 equipped theaters in the last 4 years. And Your Excellency, I've had the opportunity to be in Kenyatta National Hospital for the second time. I was in Kenyatta National Hospital as a CEO in 2012 and 2013. Today, I've come back less than 1 year. I want to confirm to you, Your Excellency, that it's not only the issue of having the 32 theaters, but what it means is that we are reducing the waiting time for surgeries, for management of our patients. It used to take a long time. It used to take long periods, and sometimes it used to compromise the quality of healthcare for our patients. Today, we have 32 theaters fully equipped, and there's no patient who can wait for more than 2 weeks before they're actually taken to theater. And on emergencies, it is done within 24 hours. Your Excellency, this has also assisted us when it comes to imaging. We used to have only one CT scan. Today, we have 2 CT scan machines, the most modern, in terms of healthcare management. And therefore, we don't have any patients waiting for CT scans to be done, images to be done, for us to have diagnosis, and for doctors and consultants, to make decisions on how they can manage them. We have gone further on a very, very sensitive issue, which has been causing havoc and I think a lot of concerns among Kenyans when it comes to cancer management. Kenyatta National Hospital in 2012 up to 2016 has only had one LINAC, or LINAC accelerator machine for management of or treatment of cancer. Until 2 months ago, now we have a second LINAC machine managing 150 to 200 cancer patients on a daily basis. Your Excellency, we expect also in the next 2 months, we are also going to get a third LINAC machine. Therefore, Kenyatta National Hospital, before September or October of this year, will have 3 LINAC machines. We will also get a PET scan before the end of this year, and we will never talk about challenges of cancer management or cancer patients' problems at KNH for the next 7 years. So as I conclude, Your Excellency.
Just for context.
Yes, Your Excellency.
Just for context, Richard. The LINAC machines, the theater machines, did you have to pay for them, or they are supplied under our NEST program?
The 15 theaters machines that we received from the suppliers of NEST, or National Equipment Service Program, were brought in free. In fact, what happened is that they brought all the equipments, including the tables, they're also including the anesthesia machines, and all other equipments. What happens is that we have an arrangement where for each and every operation, they get a minimum of 15,000, or even sometimes a maximum of 15,000 shillings. If the operation is even going to cost about 300,000 or even 400,000, they only get 15,000. So the deal is actually too good for us. And that's why we decided to maximize getting all the 15 theaters. So we did not pay a penny for those theater equipments. We never paid a penny for the CT scans. We have never paid a penny for the LINAC machine. We have not paid a penny for the mammogram, which we have a modern, advanced mammogram for breast cancers management diagnosis.
Let me, can you give us your experience on SHA reimbursements?
Thank you, Your Excellency. I want to go back to 2013 when I left Kenyatta National Hospital. We used to operate under NHIF. We have a bed capacity of we had a bed capacity of 1,800 beds. Today we have 2,200, almost 2,300 beds at Kenyatta National Hospital. NHIF patients were only 60% covered. We had only 60% patients on NHIF at KNH. Today, under SHA, we cover 90% of our patients, or 91 to 92% of our patients under SHA. And we have managed to get, as I can confirm today, Your Excellency, we have received 4.2 billion shillings from SHA in the last 18 months. So, and I think as I've heard from one or two individuals from the county facilities, I want to confirm also that SHA works. And I can tell it to all Kenyans that we have had 1 million patients passing through Kenyatta National Hospital as outpatients. We have also had 900,000 patients passing through Kenyatta National Hospital in the last 1 year. All of them have been paid by SHA, including the emergency patients.
So, are you telling the Kenyan public that the 1 million people you treated in Kenyatta Hospital on outpatient came in, they were treated, given drugs, and they left without paying a penny, and SHA paid for them?
Yes, Your Excellency, I want to say this with no fear of contradiction. I've been there for the last, I think, 10 months, 11 months. That's what has happened. I can also confirm that 9 months ago, I was in Jaramogi Oginga Odinga Teaching and Referral Hospital. And I was there for 18 months. And Your Excellency, when I was there, we actually received, I was there when SHA started in 2024, and I left last year in June. We received 900 million Kenya shillings at Jaramogi Oginga Odinga Teaching and Referral Hospital in comparison to what they used to get under SHA, which was 266 million. Under NHIF, sorry, Your Excellency. So, and I'm also here with the acting CEO of Jaramogi Oginga Odinga Teaching and Referral Hospital, and he knows very well that we did that job together, and it happened. So I want to confirm that SHA works, and the question you asked, if somebody tells you whether SHA works or not, it doesn't work. I want to say, those ones who do not live in Kenya, yes, probably SHA does not work for them.
Thank you very much.
Thank you.
We are doing more to talk to Kenyans. We have the line 147, and it's accessible 24 hours, but we also have a county infrastructure. Each of the 47 counties has a SHA office, and additionally, we have SHA officers too per Huduma Center across the country. But that being said, Your Excellency, we do take...
what did you say the number was again?
147. 147.
So a citizen can dial
147.
147.
And it goes to our call center that has callers waiting there to attend to the citizen.
Do we have people who speak Swahili there?
Ndio, tukana Wakenya ambao wanaongea Kiswahili hapo.
That is what Esther was asking.
Kuna Wakenya ambao wanaongea Kiswahili.